Walking is an important part of your everyday life. Unfortunately, it is also something that can quickly become an issue for seniors, leading to deadly falls, poor mental health, and overall decreased quality of life. Usually, poor walking mechanics happen over time. The changes are so subtle that it kind of sneaks up on you. Before you know it, your spouse or family member will be making comments like, "You're walking funny," or "Why is your walking posture so bad?" In this video, I want to show you 3 common mistakes that we see seniors making and how to fix them. Before we get into these mistakes, I want to introduce myself. My name is Justin, Doctor of Physical Therapy. I'm the founder of The Active Adult and own a physical therapy practice in Florida that treats thousands of seniors every year that have trouble with walking. The first mistake people make is shuffling while they walk. There are a couple of reasons why this may happen. First, you may lack ankle mobility, specifically having a hard time dorsiflexing or bringing the top of your foot towards the front of your lower leg. This can be caused by a lack of flexibility, either in the muscles of the back of the calf, or it can be caused by weakness of the muscles in the front of the calf, or in most cases, both. In order to dorsiflex the foot while you walk, the muscles in the front have to be strong enough and the muscles in the back of the calf have to allow the motion or be flexible enough. To test the flexibility of your calf muscles, I want to show you 2 ways. The first is a standing calf stretch. The main point of this stretch is to test your flexibility with your knees straight, because you have a specific calf muscle that is most taut when your legs are straight, and it's called the gastrocnemius. So I'm going to go up on wheel chocks, which you can get these wheel chocks from any hardware store. Walmart has them, Amazon has them. If you don't have wheel chocks, you can just use a small step like the one that goes from your front porch to your house or your back patio. But you're going to go up and you want to get almost probably 2/3 of your foot off of the ground onto the chalks of the step. And if your calf muscles are not tight like mine, you should be able to keep your knees straight and easily hold your balance. I don't want you to go right into this because the odds are you probably are a little bit tight. So you want to start off going a little bit and don't let go unless you really feel comfortable. That's why I have this chair here so you can always hold on to something. I don't feel a stretch at all right now. If you feel a strong stretch or you feel like gravity is trying to pull you backwards off of the step and you can't hold it easily, then you have tight calves, specifically that gastrocnemius. This next stretch is done in kneeling. And the reason why we're doing that is because we want to take that gastroc muscle and put it on slack so that we can get a good look at the joints of the ankle itself. So I have a stick. You can use anything like a cane. And I also have a soft pad. So if you're doing it on hard ground, use a pad or some kind of a cushion or a throw pillow, protect that knee from that hard surface. But we're really going to be testing the other leg. So I'm going to take the stick, I'm going to put it directly off of my toe, straight up towards the ceiling. So don't tilt it back or anything like that, just straight up. And the test is, can you take your knee and touch the stick without the back of your ankle wanting to lift up? So I have no problem doing this. I make it look really easy, and I can even go pretty far beyond my toe. But in order to walk with a normal gait pattern, you at least should have enough ankle mobility to touch that stick. And if you look at the angle of my leg versus my foot, that's that dorsiflexion I was talking about earlier. If you felt your muscles tight in both of those tests, you definitely have something to work on. If you were only tight in the standing stretch, then it's likely the gastrocnemius muscle that is tight. If you were only tight in the kneeling stretch, then it's most likely either your soleus muscle or the ankle joint itself, or both. The treatment is the same as the test. So just get back into that testing position that you felt most tight and hold for a minute. Do a couple of sets and do it every day. The second common mistake we see our patients make with walking is their stance being too wide. Naturally, we widen our stance when we lose our confidence and our balance and stability. Okay, so what? Isn't it kind of harmless and just may look a little funky? Nope. It's actually very dangerous. The reason it's dangerous is because the further apart your feet get, the further your feet are from the center of gravity, or kind of that midline of your body. And because 70% of walking is done with only one foot touching the ground, the whole time that other foot is off the ground, the further that distance is, the more you're falling as you're walking. And if anything happens, if you catch your foot on a rug or you trip yourself up, you're gonna go down like a sack of potatoes. Whereas when you walk more normally, which normal walking, your heels are less than an inch apart when you walk. When you're that way, you're more stacked right underneath the center of gravity so that you're allowed to make more mistakes and you don't feel like you're gonna fall. The best way to feel comfortable in walking with your feet at the proper width apart is to improve your balance and your hip abductor strength. I'm not going to go into the details right now of which balance exercises to do because we have a couple really great videos that cover it in better detail. But before I move on, I want to stress to you that even just 5 minutes a day of balance practice will help you make amazing progress after just a few weeks. To explain why the hip abductors, or the muscles that kind of live on the side of your legs, even into your butt a little bit, why those matter with walking is going back to what we were just talking about. When you're on one foot while your leg is swinging through, the leg that's still on the ground, its job is to have that hip abductor pulling down to keep your other side of the hip from dropping when you walk. You may have seen people with weakness of the abductors when they walk, they'll drop their hip and it kind of looks like this when they walk. I'm exaggerating, of course, but it's important to build the side muscles of your hips. So walking front to back, it doesn't do enough for that. That's why we like to sidestep. When you sidestep, keeping your feet straight, you're really targeting those hip abductors. Without any resistance, this may be a little bit too easy also. So we like to wrap a TheraBand or another piece of tubing that we can use around our knees when we try. We like to use these hip core bands. They're made by a company called Crossover Symmetry. Obviously, I don't want you guys to get into this without holding on or sitting down, but you can stick both feet through the loops, put it just above your knees. You want to get yourselves in a nice athletic posture, a little bit of bend in the hips and a little bit of bend in the knees. And then you want to just walk sideways. So back and forth. I'll also show you this way so you can get a good front view. And as I get fatigued, my feet are going to want to start turning out. I want to try my best to keep my toes straight in line with where I started. That's going to really target the hip abductors. The reason why your feet are going to want to turn out is because you're trying to make the hip flexors do the work that your hip abductors should do. You're trying to use what you're strong at and avoid what you're weak at. And that is the hallmark symptom of what we do as humans to cheat. We're cheaters and we have to consciously make sure that we're doing things correctly. The third and final mistake I want to talk about is the speed at which you're walking, or your gait speed. Most seniors walk too slow. We actually have a speed range where we are most efficient and controlled when walking. If you walk too slow, your foot will slow down too much and you'll tire yourself out quickly. When you're tired, you're more likely to make a mistake like having a fall. So you want to pick a speed where you can feel good about your rhythm with a little bit of bounce in your step. It'll take some practice, but make sure not to overthink it because we're not supposed to think while we walk. Walking is more of a subconscious activity like breathing. Overthinking it will actually lead you to move like a robot. You want to walk with a rhythm like you're listening to a Ray Charles song. We hope you found this video helpful. If you did, please consider supporting our channel by subscribing, liking this video, and sharing with a friend or family member. Your support is the only way we're able to keep putting out this free content each week. Also, be sure to check out other videos on our channel, like this one. Until next time.